Just last month, Meridian Healthcare was awarded more than $200,000 in grants to help pregnant women and mothers of young kids who are living with substance abuse disorders. This morning, the healthcare organization broke ground on a new $2 million expansion and renovation project. Joining us now to talk about the project and how it will benefit the community is Larry Moliterno. He's the president and CEO of Meridian Healthcare. Larry, thank you for being here.
How are you today? Good.
Very good. This is great to hear that you're working on this project. It is 3,000 square feet of new space. This renovation was on the existing part of campus. So how are you going to utilize all of this space? What's going to go in there?
Well, the funny thing is that Meridian's been around for over 50 years. And we have constantly just tried to adapt to the needs of the local community. We continue to do that. What we wanted to do was to make it more convenient for our patients for both primary health care and on the behavioral health care side by putting a pharmacy in our building on Meridian Road. So the great thing about that is the patient can come, they can see their physician, or they can get their prescription, and before they leave the building, it's right there for them. So it's just going to be easier for our patients, and that's what we're all about.
That's so wonderful. And what else will you use this space for? What are some of the other people that you're going to be treating?
Well, what we're really trying to do is to have this message that we need to bring together physical primary health care along with behavioral health care. Too oftentimes they're treated separately, and what we have found was on the behavioral health side, how many people who struggle with either addictions or mental illness don't have a life expectancy as well as people who don't. And a lot of that is because they don't get the proper health care. So we started providing that. But on the other side, we've also found on our primary health care side, because we have a number of great providers there, people who are diagnosed with anxiety or depression, for example, who get a prescription from their physicians, don't go to a counselor. So you're not able to really get to the root of what your anxiety or depression is coming from and learn how you can identify triggers and how you can learn how to work yourself through those triggers when you identify them. And also, I think a big part of this we're trying to bring together, think about how many people every day are diagnosed with cancer, or muscular dystrophy, or prostate cancer, and think about their families. What we're saying is we have to link those folks with mental health support. There's a lot of studies that talk about post-operative depression, for example, for heart patients. We want to be there for these folks.
And a lot of times you may see the doctors and they say maybe you don't need medication, maybe like you said you can work through some of the things that are triggering you or upsetting you. Would you say that this might be the perfect way to navigate that and find that right path for someone?
We're trying to work with the patient on both sides, behavioral health side and the physical health side, and their families for whatever support that we can give them. We just started a brand new program, which is exciting to me. It's helping people deal with chronic pain. So many times people have chronic pain and they know how to deal with it with medication and things like that. But unfortunately, for some people, there's chronic pain they're just going to have to learn how to live with. And we help them from the emotional side and the mental health side of figuring how you work through that. How do you get up every day knowing that you're going to feel that pain and find a way to power through?
Yeah, and is it probably a combination of methods, not just obviously medications?
Well, for a lot of these folks, unfortunately, they tried medication and sometimes opiates, which led to other problems. And so what we're really doing, because we also are offering chiropractic, acupuncture, as well as emotional and mental ways to deal with chronic pain.
Okay. And we also mentioned the pregnant women and mothers of young kids living with substance abuse disorders or other issues. That will also be sorted out on this campus.
We work with a lot of moms, probably 40, 45 moms on any given day who are either pregnant or have just given birth. And we try to help the families with the adjustment, help the mom through that, making sure the mom's getting proper care, making sure the child's getting proper care, helping them through that transition of those first 6 or 8 months with the baby, and we're having a lot of success with it.
Oh, that's so good. Moms need that, especially those early weeks. They could be dealing with symptoms that they're not even sure they're going through, so that's great to hear.
Well, and we're really trying to offer a lot more support. Postpartum depression is something that everyone doesn't talk about.
Right.
We want to talk about it more because we recognize that many moms deal with that that comes right after the birth, and so we're offering that service for people and those kind of specialty counseling, even helping people deal with grief, helping people deal with postpartum, even helping people who've lost a pet. That's very significant for people who've lost a pet. That's an emotional connection that they're losing. And so we're trying to offer counseling for all those folks.
I'm glad you're bringing awareness to all of those things. Like you said, they need to be talked about more. Thank you so much for being here, Larry. Appreciate your time, and congratulations on this huge expansion. I think a lot of people are going to need these resources.
Thank you so much. We have a lot more good news we're going to be coming out with very soon.
Good to know.